Hello friends, I am Dr. Sunny Jain. I am head of the Oncology department in Marengo QRG Hospital, Faridabad. Today I will be talking about early signs of cancer. So to start with, what is cancer? So any uncontrolled, unexplained, unregulated growth of cells in any part of the body is known as cancer. The cell which should not be there, at wrong cell at the wrong place at the wrong time, and when they form a family, they form a lump, they form a disease which is known as cancer. So elaborating the same definition. So any painless swelling becoming painful. Any swelling which was painless till yesterday and all of a sudden last 24 to 48 hours or maybe in a week's time, it has started becoming painful, is an early sign of cancer. Whenever any painless swelling becomes painful, please see your doctor. Second, any sudden change in size of the swelling, means a small swelling which was there for years, all of a sudden it has started growing. Earlier the size, it was a size of, let's say, a small pea. Now all of a sudden the size has gone on to a size of a lemon. That's how normally an individual describes the swelling. So any sudden increase in size of the swelling can also be an early sign of cancer. So you need to see your doctor. Then unexplained weight loss. I mean, patient is not fasting, patient is not doing any measures to lose weight, but more than 10% of the weight loss has happened in last 2 to 3 months, which is unexplained. Patient says that I am not doing anything but still I am losing weight. Again, it could be a sign of cancer. Not that any weight loss, all weight loss is cancer, but yes, these are early signs. So eyes cannot see what the mind doesn't know. So your mind should know this, that these are the early signs of cancer. Then a person has a mole, change in size of the mole. There was a very small size mole, and all of a sudden the blackening around the mole has increased. This again could be a early sign of skin cancer. So moving on, suddenly there is change in voice, there is hoarseness of voice, patient is not able to eat food well, patient says there is pain in deglutition. Deglutition means when the patient is swallowing food, patient feels pain. So these could be early signs of any head and neck cancer which involves tonsils, tongue, pharynx, larynx, could be anything. So moving down further, if there is any lump which a woman notices in her breast, so I always tell this to all my patients in all my seminars. Any women more than 40 years of age presented to your OPD with a lump in breast is to be considered as cancers until and unless proven otherwise. So any female who just diagnosed herself to be having a lump in the breast, in the armpit, could be early sign of breast cancer. So there are some non-specific. The earlier ones which were non-specific, these are little specific signs or symptoms that we are talking. Let's say someone has a gallbladder cancer or a liver cancer, or let's call hepatobiliary cancer. So that patient might be complaining of yellowish discoloration of the skin. The patient might be complaining of passing whitish colored stools. So pain in abdomen, little vague though, but pain in abdomen is commonly seen. So these could be the signs of gallbladder cancer, liver cancer, or let's call it a hepatobiliary cancer. Patient started throwing up, they're vomiting, projectile vomiting. Projectile means when you vomit, the vomitus, the product that comes out goes far away from the body. That's called projectile vomiting. So this could be the sign of that there is some obstruction. Now obstruction again could be because of, obstruction could be at various levels. It could be at the esophagus level, it could be at the stomach level, at the intestinal level. So any gastroesophageal cancer can present as patient will complain of regular heartburns, projectile vomitings, difficulty in eating food. Patient might give history that there is collection of food and all of a sudden there is passage of food after some time. All this signifies that there is some obstruction, maybe the patient is suffering from gastroesophageal junctional cancers. Or the patient complains of pain abdomen, again vomiting, loss of appetite. Loss of appetite is very important sign. I would call it early sign only, because if there is stomach cancer and if there is growth inside the stomach, so the volume of the stomach goes down, because of which the amount of food that patient takes goes down. Let's say patient was earlier taking 3 chapatis at a go. Now patient is feeling full only at 1 chapati. Reason the volume has gone down because there is a growth inside the stomach. So loss of appetite is also very important early sign of cancer. Moving on, any patient presenting with lower backache, constant lower backache, there is no history of trauma, there is no other history. This could be early sign of bony metastasis. When I say bony metastasis means the cancer has spread to the different parts of the body, including the bone. So the most common bony pain is seen in the lower part of the body, in the lower part of the spine, I should call it, because that is the weight bearing area. So the commonly pain is seen in the weight bearing area. I'm not talking about the small joints over here, which is usually arthritis in our country. But yes, pain in the lower back, pain while walking, pain while sitting could be early signs of bony cancer, or maybe signs of spread of cancer to the bony parts of the body. Moving on, this brings to a very important point. Coughing up blood with sputum, without sputum, means cough with sputum plus minus blood. Not all coughing with sputum plus minus blood. All coughing is not tuberculosis. This is a very sad scenario that I am saying today, that most of the lung cancer patients are invariably being treated for tuberculosis for a certain amount of time, maybe a month, maybe 2 months, till the time we realize that no, the person is actually suffering from lung cancer and not tuberculosis. Because in India, tuberculosis is very common, and me as a undergraduate, we were taught that tuberculosis can present with anything and everything except pregnancy. But friends, let me tell you, the scenarios is changing. The disease is changing, the outcomes are changing. So lung cancer is a very well established, and it's a known cause of mortality worldwide. So don't underlook, or don't over treat, or don't over diagnose the tuberculosis. So cough with sputum plus minus blood is a sign of lung cancer. Please see your doctors immediately if any of the signs that anyone experiences in his or her life, because what I feel is that lack of knowledge, and as well as the lack of practice, is something which is actually hindering us to see the good outcomes, the good success rate, the good survival rates. That is where I feel India as a country is lacking behind. I call it as CAP gap, that is knowledge, attitude and practice gap. And I urge everyone to kindly close this gap. Lesser is the gap, better is the survival, better is the outcome, better is the survival percentage. So early diagnosis leads with early treatment leads to better percentage of survivals. Cancer is a disease, it is not a death sentence. Thank you.